Quick shout out to everybody who is subscribed. I appreciate each and every one of you for showing me support. If you are not yet part of the subscription community, go ahead, hit that subscribe button. It's completely free and you won't miss another episode. Enjoy this. What is up, everybody? Welcome back to Sterling's World, getting your questions answered by people from around the world. We're going to catch up today on Mexico. It was my last interview with Mar. We're going to go through a couple things here. We're going to go through government transparency, how important that is. We're going to go through coming out of lockdown, some news stories that have developed coming out of hospitals that I have heard passed down to me from friends that work there. And once again, we're doing this thing live, more or less. And I'm going to talk a little bit about this thing and why it seems that I keep having this freaking cast on every time we talk, even though it's been 2.5 months. I went through a pretty bad injury. I'll cover that at the end, though. If you give a shit, stick around and watch that. It's pretty interesting what happened over Thanksgiving. So about 6 months ago, this thing happened. But quick recap. Let's cover the numbers real quick. So worldwide, we got 5.7 million cases. The active cases on that are 2.9 million, which is still a lot, and it's going up every single day, even though the world has more or less been on quarantine. The US is at 1.15 million cases, averaging about 19,000 cases per day. Total deaths have reached over 100,000 now, 101,000 in the United States, and still averaging about 774 per day. So this is really strange, right? We're coming out of this quote unquote lockdown, and we're still averaging about 775,000 deaths, or 775 deaths per day, and we're coming out of lockdown. Can you imagine if this thing hits another wave and it goes back up to where we're getting like 36,000 new cases per day? Hopefully this doesn't happen and people take it seriously. But jumping into that, right, coming out of lockdown, we've seen it was just Memorial Day last Monday, so 2 days ago. Happy Memorial Day to everybody. And I know we're all frustrated, cooped up at home, but I was watching this thing in Ozark, or was it Ozark, Missouri? No, Ozark, yeah, Missouri, on the lake up there, and they were partying. Bars were opening, they were serving drinks. Now, I personally think you guys are idiots. I went down to Newport Beach with my mother the other day for Mother's Day. We took a cruise down there to see if we could see the bioluminescence down there, and we didn't see any, but I did see a lot of people walking around with no masks on, crowded streets as if it was just a normal day. Remember this, it's a pandemic. This isn't like a stay home for 2 months and all of a sudden this thing is gone. This thing's sticking around. It's going to be here a long time. So do your part and stay inside. I mean, go out if you want, but wear a mask. Be responsible. I just think it's really, really stupid to think that this thing's going to go away and that this thing isn't actually going on. So jumping back to numbers, Mexico, they are at 13,500 cases, 8,000 deaths, much higher death rate than we're at. And the interesting thing is the hospitals there have recorded an 8,000 in Mexico City. They have recorded 8,000 new deaths, jump in deaths per week. And they're not associating it to the coronavirus, but they are saying that the ramifications of the coronavirus is now impacting other parts of the hospital, which is why they're having this sudden increase in deaths. I'll give you an example. There was a 47-year-old Mexican man with a family who was working. He was a doctor there in Mexico City. He was doing all the right things, taking all the right precautions, wearing the masks in the hospitals, going through with the face shield, treating patients, that kind of thing. When he came home to his family, he would take his shoes off at the door, throw his clothes in the washing, and go up and take a shower quickly. He was even sleeping in a separate bed in the house, and he still passed away at the age of 47 years old, which is quite young when we all thought it was a disease that attacked the elderly, 60, 70, which is the case. They're more susceptible because of their weaker immune system, but it doesn't mean it stops there. Some breaking news in the States was there was a record amount of younger people getting this virus. They were getting it, contracting it from who knows where, but they were also dying. And these are kids that are at the age of 14, 15, up to 18 years old, who we deem to be probably the most healthy of all age groups as far as their immune strength goes. So jumping back to Mexico, the 8,000 new deaths that are unexcused, unrelated more or less to the coronavirus could be due to that. And it could be due to the lack of infrastructure, but it also could be due to the lack of materials, the lack of protective gear that they have in the hospitals. Even though everyone's doing what they think is right in the hospitals, it seems to still have this backlash effect, and more people are getting sick, and others are dying in other parts of the hospital that might have been treatable if they had the right staff, and if they didn't have this coronavirus outbreak, which starts to affect everybody. When you think about nurses and healthcare officials getting sick, they then can't help everyone else who needs help. So that's a big thing. So coming out of lockdown, keep those things in mind, please. You're idiots for partying. I'll say it if no one else wants to say it. I'm not going to sugarcoat it. Do your part. Stay inside. Keep everybody safe. So that's more or less what I wanted to talk about as far as the coronavirus goes. Now, to answer everyone's questions about what's going on with my cast, I'll put some pictures of what happened with my injury. But it was a motorcycle accident out in the high desert over Thanksgiving. I totally destroyed my wrist. I went to the hospital and they operated on me, which they thought it was going to be a 2-hour surgery. It ended up being a 5.5-hour surgery. They had to put a bunch of pin screws. I don't even know the terminology they say, but different kinds of screws even, which was pretty hectic. They took me into an emergency surgery right away to remove this carpal tunnel inflammation problem that was going on. And then 2 days later, they reconstructed my wrist with this 5-hour surgery. I just got some bad news. Actually, the bone that they screwed back together is not healing properly, even though I have this bone stimulator thing that sends an electromagnetic field through my wrist to help stimulate the blood flow. I guess it's not working. And the bone's not healing, so I'm in a predicament where I need to go back to the hospital, and they'll do some bone grafting and reroute some vascular. I don't know what's going to happen. They're just going to reroute some blood vessels pretty much to hopefully improve circulation and get this thing healed. I'll put some pictures though, probably popping up right here, I guess. But yeah, that's that. So everyone do your part, stay inside. Coming out of lockdown does not mean it goes away. It means that it's still here, and don't be an idiot and think you're not gonna, don't be an idiot and think that this isn't gonna affect you, because the moment you get somebody in your family sick and someone close to you passes away, it's gonna affect you. You're gonna feel it. So do your part, stay inside, everybody be safe. I hope we come out of this lockdown quarantine really soon, but that does not mean, like I said, it disappears. Do your part, stay safe, spread love, and make sure you get in touch with all your friends from around the world, and show your compassion for them, because they're going through a lot as well. Stay safe, everybody.